Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers. June is Gun Violence Awareness Month, and today is all about safe storage of firearms. Dr. Katherine and Crifasi, both researchers at the Center for Gun Violence Solutions, join me to talk about why safe gun storage is such an important part of violence prevention. We also talk about some tools for various stakeholders, including policymakers, parents, and pediatricians, and how we know that safe storage practices really work to prevent tragedies. Let's listen. Dr. Katherine and Crifasi, thank you so much for joining us on Public Health on Call. Today, we are talking about safe firearm storage. And when we think of gun violence prevention, people may not think about storage as being part of the problem. So, Cass, can you tell us a little bit about this?
Yeah, so what we know about firearm ownership in the U.S. is among people who own guns, less than half of them store all of their guns safely. And what this translates to is lots of people who can't legally buy guns or own them, potentially having access to them, including an estimated 4.6 million kids who may use them to unintentionally harm themselves or take them to school. And so when we're thinking about firearm injury prevention, we're really thinking about the suite of activities that we can engage in. Sometimes that's laws and policies. Sometimes it's the individual behaviors that we expect people to engage in.
Yeah, and you have a lot of safe storage tools, and they are geared towards these different audiences. So that may be a good way to approach this. What are some of these different audiences? And maybe you can give a couple of examples. Let's start with one, Cass.
Yeah, so one thing that we have done, recognizing that a key tool in the public health toolbox is policy, right? So sort of a population level tool to advance the kinds of behaviors that we want to see. We have created a model policy guide for states that are considering implementing child access prevention laws or strengthening the laws that they currently have on the books. And a key piece that we think is really important that's unique about this model policy guide is that it extends the concept of child access prevention to other people who might be prohibited. So a state may have a policy that says children under the age of 16, for example, can't have access to guns, so gun owners need to store their guns in a way to minimize access to that group. We say, well, there are people who can't own guns for other reasons than age. Maybe it's criminal prohibition or mental health prohibition, and we think that those safe storage standards should extend to that group as well. So we make recommendations on what are best practices based on research, as well as sort of what we think is on legally sort of good ground to be able to advance these kinds of policies.
And so just to clarify that last point, so if you own a gun, but you have someone in your home that is not legally allowed to own a gun, these are policies that would apply to you as the owner and how to safely store your weapon.
Correct. And so it takes that same concept of minimizing access among kids and teens and extends it to other prohibited groups.
Okay, so let's talk about some tools for another specific group. Let's talk about parents, which you've already mentioned, but what are some tools for parents, Katherine?
Yeah, I think actually that's the perfect segue because, of course, you don't have to have a safe storage law, a child access prevention law to practice safe storage in your home. And so there are so many great resources on the center's website, but one that I'd really like to highlight is our safe storage info sheet. It's one that we developed that articulates why safe firearm storage is so important as a means of preventing injuries, for families who own guns in the home, even for self-defense, for home defense. These things are not mutually exclusive, right? You can own a firearm for personal protection and store it safely. And, this info sheet helps to provide parents or gun owners who are not parents who just want to practice safer storage behaviors at home to protect their family from another potential threat, and that being the threat of unintentional firearm injuries, firearm suicide, or other reasons.
Can you give us an example of some of the tips that parents might find on a sheet like that?
So the info sheet basically gives the data for why safe storage is important, why safe storage matters, how many injuries may be attributable to unsafely stored firearms, and then really importantly, it tells you how to do it. It tells you that firearms should be stored unloaded in a locked safe or cabinet separate from ammunition, every gun, every time. And this is something that's really important to Cass and I, both as parents and gun owners, right? So this is something that we, not only preach, but practice in our homes.
What if, for example, you are the parent of a child, but you don't own a gun, but you're curious about, other places your child might go, like for a play date or something like that?
Oh, yeah, absolutely. I mean, I think, we encourage everyone to be practicing this in their own way, right? So if you are a firearm owner, then store your gun safely. If you aren't a gun owner, chances are you know someone who is. And so maybe that's having a direct conversation with a family member who is, or maybe that's just, working into your routine, sign out with another parent when your kid is going for a visit, in the same way that you talk about their allergies or, other habits. My kid has a peanut allergy. I just want to make sure that he's not going to be, having a, peanut butter and jelly sandwich at your house. Or, my kid climbs on everything that he can possibly get onto. Just want to give you a heads up that, you might want to be attuned to that. Similarly, you can ask about the presence of firearms in their home and feel empowered to inquire after how they are stored. That may be an opportunity just to learn something about, someone in your social circle or in your family, an opportunity to teach. But certainly, we as parents have a lot of uncomfortable conversations and would want to encourage other parents just to feel like, this is an okay thing for you to be asking about because it's all about, the safety of your kid.
I was just going to add that we have a resource to help with this conversation. So we have a one-pager that the center developed that sort of models this conversation via text message and shows that it doesn't have to be as awkward as it might feel. And also, if you don't feel comfortable with the answers to those questions, this provides some alternatives of how your kids can still play while you feeling comfortable about the kinds of things your kids might be exposed to.
Katherine, you are well positioned to talk about this because you're not just a gun owner, you're not just a parent, you're also a pediatrician. And I know that that's one of the other audiences that these tools are meant for. So can you talk about what is available there?
Yes, and I wear all three hats at once all the time. And, I think that the same resources are helpful for pediatricians, are helpful for anyone who cares for kids or works with kids, teachers, folks in childcare settings. But especially for pediatricians, right, where we are talking about a whole host of other, injury prevention measures that can be undertaken in the home, starting to incorporate inquiring about safe firearm storage and the presence of firearms in the home is certainly something that we want to encourage physicians, especially pediatricians, to be doing routinely. And, some of these same resources that we've developed, again, the info sheet that we referenced before is incredibly helpful to put in your waiting room or to hand out to patients in your care as you're having these conversations, because, that can really just help to open up a conversation by sharing information, by sharing best practice. And, something we didn't mention before, it also links you back to other resources through the center's website. Really, we just want to develop more tools to support clinicians and people in general in having these conversations. So much of our mission is to help to normalize conversations around safe and secure storage, right? We want this to become kind of part of our common practice, part of our common parlance, so that we can engage in these kind of conversations in our doctor's offices, in our play dates, and whatever the setting.
And Katherine, these tips are not just good ideas, they're also really rooted in research and evidence. Like, they weren't just things that you all came up with in a brainstorming activity. So tell us a little bit about the evidence base you have for these solutions.
Yeah. Safe storage is probably one of the best interventions available to us to prevent firearm injuries. We know from years of rigorous research, including by members of our team in the center, right, that safe storage prevents firearm suicide, homicide, unintentional injuries, and theft, especially when we're talking about youth injuries. But it helps in all of these different domains because safe storage helps to interrupt a pathway from access or exposure to use or injury, right? It puts time and space between someone who's, exposed and, to a potentially deadly weapon. So if we think about youth suicide in particular, right, we know that having a firearm in the home increases the risk of suicide, which is not to say that having a firearm in the home causes suicide, of course, right? But it does increase risk by several fold, even controlling for, multiple risk factors. But when young people do die by suicide, by firearm, almost 80% of the time they've used a firearm obtained in their home, a family member's firearm. But safe storage can really reduce that risk, because when someone then is in crisis, then they aren't able to readily access lethal means.
That's a great example. What are maybe the biggest take-home messages about gun safety and storage right now in this moment? Cass, let's start with you.
Yeah, I think there are a few really important things to keep in mind. So safe storage can be a policy, but as we've discussed, it's a really important behavior. And too quickly, when we have a conversation about guns, it devolves into a rights argument, and we forget about the responsibility piece. And with every right comes these responsibilities, and it is important, if you choose to exercise your right to own a firearm, that you engage in all of those responsible behaviors. Another really important point, as Katherine may have highlighted earlier, it is not inconducive to own a gun for home defense and store it safely. You can have quick access safes or other safe storage strategies that can allow you to get a gun quickly should you need it, while also making sure people who shouldn't have it don't get it, whether that's theft in your home. But importantly, this extends into our vehicles. As more people carry guns in public, maybe there are places they can't carry, it is equally important to make sure that guns in cars are stored in a safe manner. The last thing I'll lift up is separation in time and space from, a person that needs to be protected and the harm is really core to injury prevention. And even a handful of seconds of separation between a person who may be thinking of harming themselves and a lethal means like a firearm can save lives. As Katherine said, guns don't make people suicidal, but they do increase the likelihood that someone who is experiencing suicidal ideation will die, because 90% of suicide attempts with a firearm result in a fatality. But we can prevent this by safely storing our guns unloaded, locked up, separate from ammunition every time.
I do want to ask how one safely stores a gun in a car.
They have safes that you can build into a glove box, you can build into your spare tire well, or the center console that is prevalent in many cars. I don't know if you watched The Rookie, the TV show, The Rookie. There was an episode that we just watched this week where someone was being shot. It was somebody involved in the criminal legal system, and they showed him opening his center console, inputting his key code and pulling his firearm out to be able to defend himself. And I was so excited. I was like, yes, safe storage on TV. I love it.
Showing up in pop culture. We love to see best practices everywhere. All right. So, Katherine, I will give you the last word on this.
I think carrying on that message, I think everybody has a role in firearm injury prevention, especially when it comes to safe storage, even Hollywood, right? We are wanting to encourage people, whether you're a longtime gun owner, a new gun owner, a never gun owner, a mom, a teacher, a physician, just a person in the world, we can all be having these conversations, right? We can all ask about how firearms are stored. We can encourage people in our lives to practice safe storage, or we ourselves can practice safe storage, every gun, every time, to protect more people and especially more kids from firearm injuries.
Katherine Hoops and Cass Crifasi, thanks so much for joining us on Public Health on Call.
Thanks for having us.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Katherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.